World. You're listening to WCEG Media Enterprises. We are the worldwide community empowerment group where we speak life into the community. Log on to WCEG Talk Radio and watch us live on your smart TV, on Roku, cable channel, YouTube, Facebook. Wow, anything. LinkedIn, and now Fanbase, Blue Sky, and Twitch. Search for WCEG and subscribe, like, connect, and follow us on all the social medias. I am Anthony C. Aiken, co-host, along with my good friend. Hey, who are you, my good friend?
I am Herman Anderson. How you doing, my friend?
Oh, man, I'm doing great, and it's always good to see you. So everyone out there, download our free WCEG mobile app. Say, Alexa, play WCEG Talk Radio, or listen to WCEG on any of the 11 podcast distribution platforms. Last but not least, our disclaimer: the topics and opinions are those of the show hosts and guests and not WCEG Enterprises Incorporated. Thank you for your continued support. My brother Herman, how you doing?
I'm doing great. We welcome all our audience to Veterans Today, WCEG Enterprises. We are here for another version of edition of Veterans Today. Uh, Herman Anderson along with Anthony Aikens, and today we are going to discuss several we're going to present information on several topics, so we are ready to get started.
That you're great, Herman, because now we're in 2026, and we all know there's one thing looming that's always been in our life. That's April 15th, tax season. That's that, and that's something everybody got to deal with: tax and death, right? So today we're going to talk a little bit about taxes and how it's important for you because the tax season is here, and many VA benefits are exempt from taxes. And before filing, always review the Veterans Tax Information and Services page on the IRS website, and you'll be able to safeguard your identity from scams and everything like that. But you'll be able to get very good and important information in regards to you filing your taxes. So we implore you to go to the IRS website and take a look at the VA benefits for exemption for taxes.
And just to add to that, a couple of bullet points that we want our veterans to know with whoever you are paying to do your taxes or how you uh, do your taxes. Number one, bullet point: tax benefits as a veteran disability benefit that a veteran receives from the VA should not be counted as part of veteran gross
We
income.
can't hear you, Mr. Herman. We can't hear you.
Should not be counted as part of a veteran gross income. Payments from compensation, pension, veteran readiness, employment, education, including GI Bill, are exempt from taxation. Always review, as Anthony said, the tax revenue latest ruling on that. So when you're dealing with your accountant, the VA, uh, the military bases, whoever you are preparing your taxes, make sure that they take that into account.
Right, because you all you want to do is save yourself some money. Um, Uncle Sam or the IRS or whoever you want to call them, they're going to get their dollars. But we want to make sure that as a veteran, you take all your exemptions. You've earned it. You've earned it. Nothing's given to you. So why don't you take advantage of it to take care of yourself and your family? So again, tax season is here. Many VA benefits are exempt from taxes. So do your due diligence and do what you can for yourself and your family. Now, there's one other thing, Herman, that I'd like for you to elaborate on because that's something that we all deal with, and that's dealing with benefits and compensations. Right now is a great time for veterans to take a look at that. So why don't you expound on that a little bit for our listeners so we can bring them up to date on changes and what they need to do.
Dealing with benefits and compensation, one thing that as a veteran uh, to start with at the beginning, you need to make sure you are in the system, uh, whether you are filing for dis compensation for a disability, whether you're filing for uh, aid in attendance, whether you're filing for even there are three major systems also in burial is part of that also. The number one thing to do is to uh, let's start with the older veterans. If you say a Vietnam veteran, when we got out, myself being one of them, Long Anthony, the transition program is not as well as it is now.
Correct.
So you probably wasn't transitioned from whether you were discharged or whether you were retired. You were kind of probably left on your own to get in the system and file all your claims and stuff. In today's environment, the transition program for veterans today, uh, the military helps you makes it available to you to start filing your claim, to start getting in the system before you are discharged from the military. Uh, yeah. So either way, what you a couple of bullet points on what you need to do. Number one is gather evidence and document.
You're having difficulty hearing you, Herman.
Number one is gather evidence and documents to submit to file your disability claim. Uh, Supporting documents, and that means your records. That also means copy of your DD 214.
that famous document.
So you got to have that somewhere. And so and there are all of your medical records, the ones that you have. If you're a career veteran, you have a lot of military records. If you're a civilian, you have civilian records. There are particular forms that is available uh, to fill out. So from the starting point is you need to gather all your evidence. Then later on we'll talk about the process. Are you going to file your claim yourself? Are you going to seek assistance from a VSO? Are you going to hire an attorney? Are you going to ask the VA? You also, Georgia Department of Veteran Services, all states, most states, has Department of Veteran Services. So,
Correct. Yeah.
what are your options?
Yeah. It's important to know your options, especially when dealing with these benefits and compensations. The VSOs, Department of Veteran Affairs, and all of them are there for you, but you need to know and understand the rules of engagement because the VA is limiting apportionment of disability benefits. And it said the VA has implemented a new ruling that will limit the circumstances in which compensations, pensions, and dependencies and indemnity compensation (DIC) benefits are apportioned, stopping need-based apportionments going forward. So you need to understand all of these things. You got to go on va.gov. You get to read these items, and if you can't have a family member, someone to assist you, so you'll know everything involved with getting your benefits and compensations.
Yeah, and just to reinforce that, it's uh, VA medical records, hospital medical records, private medical records, hospital reports, and as you mentioned, supporting family members and also military buddies. Uh, Anthony and myself been in the system
A long time.
quite a few years.
Yeah, long
So
time.
if you have a buddy that was stationed with you that know that helps too, and so that all of that are your option, and also it as to reinforce. Uh, we also will review your DD 214. So the
Correct.
DD 214 is going to pop up.
That's
So
exactly
be
right.
ready.
Exactly right. I keep mine on my phone. Herman laughs at me, but it's on my phone, on my iWatch, everywhere, because you never know when you're going to need it. And we tell veterans all the time there, you can get it easy uh, by going through the Georgia Veteran Affairs, et cetera. There's a number you can call to request it, but that's a very, very important document. And again, we want to say to you, benefits and compensations is something that you earned. Now, here, Herman said earlier, we've been in the system a long time. That's true. But we still fight the system for things that we need. I mean, such as aid and attendance. I've been trying that 3 times now, been denied. It's been showed that over 90% of those individuals that apply for aid and attendance have not been denied. But you got to continue. Now, there's caregivers, and that's something that, Herman, let me do drum roll. Caregivers. Why don't you talk about that great thing that just happened for you and can happen to other veterans?
Caregiver is a very important benefit that we have earned. Everything we talk about, it's as a veteran spouse, we have earned this benefit in uh, care, applying for caregiver support for uh, for yourself, even for a family member. The the process is to deal. Your your primary contact is your primary care doctor at whichever VA you are served, uh, and your social worker. The application uh, is short.
Yeah.
It's important that also that the your primary care doctor and your social worker is on board, and you also have all of your VA records up to date. If you like Anthony and myself, you've been in the system, so they're up to date. Uh, it's like the VA is is in different lanes, different silos. If you're dealing with compensation for disability, they don't really talk to the caregiver people. So
No, no,
you got to make sure all your records update. So when the social worker contact you, uh, your social, your claim number, have that available and provide uh, accurate information. Uh, they you're in the system that they're gonna ask social date of birth. I mean, just make sure that the social worker gets everything that person needs so they can go in the system and see your records from the primary care doctor. Because as I say, one of the issues at the VA is one department doesn't talk to the other.
no. Matter of fact, people need to know that the hospital and the regional office that makes the determination are two separate entities, totally separate. So, as Herman said, they don't really speak to each other. That's why it's so important for you to have that good communication based with your primary care physician and your social worker so they really know your story. Now, another point that veterans tend to not do, unfortunately, once they receive their ratings, let's say they receive a 100% rating and they're not T&P and they're not unemployable. They think they're good. They don't go to their appointments. That's the worst thing in the world for you to do. If you have an appointment, please go to your appointment. Because you're thinking, well, I made 100%, I'm done. No, you're still being watched and reviewed and checked. So if they make an appointment for you, please go. And if you can't go, call them and let them know why and get it rescheduled. So it's not a done deal.
We can't emphasize that enough, because I know people that have got their rating cut. I mean, you didn't go to appointment, and they sent you a snail mail copy in 30 days before you got it, and by that time they have sent you uh, something electronically and probably made one call and you didn't answer it. And next thing you know, your compensation is cut, and you have a, a, a certain amount of time. I think it's maybe 60 days to get it back, and that's that's hoops that you we can avoid having to jump through. Uh, in today's environment, uh, you can almost forget about dealing with getting stuff. You do get stuff in the mail by at least 2 weeks after it's already happened. So it's and a lot of the phone calls that you get with the technology, the call ID don't necessarily tell you who's calling. So you got to be very on board by not missing those calls. Because I was just told this week, we're gonna call you twice, and if you don't answer, then we just gonna drop the claim.
That's right.
So
And then,
it's
and then you're pissed off.
so
Because
it's and my health event is getting the technology. It's what is it? Government uh, government.org, and now is a login, and it's really ID. I set up ID Me. If you set up ID Me takes you into government.org, and you can go into the system and go anywhere you want to.
yes,
And 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 my healthy vet is the premium my healthy vet. You can make appointments, order prescription, uh, reschedule your appointments that you miss, and make sure you don't miss them. All that is important dealing with uh, your compensation for disability. It's important dealing with uh, the because each process is stands on its own. Caregiver, the process, that's one, aiding attendance, and there are other opportunities too. And when you're dealing with all of those, and you're dealing with all of the departments at the VA, like prosthetics, like physical therapy, the eye clinic, uh, all of those, they tend to make one call or two calls, and if you don't respond to you, they just kick you out, and you got to wait 3 months. So that is important.
you get kicked to the curb. because you didn't do your due diligence. Again, we can't emphasize enough to make sure that you make your appointments. If you can't make it, call in and reschedule it, because you're going for things that you earn. I call it the B and C, benefits and compensation. And there's tons of money out there that you can get. And one in particular that veterans are not taking advantage of is dealing with the housing, helping you get a home. And for those veterans that have a home and then meet the criteria of being 100% disabled, et cetera, there's the thing called a special adaptive housing grants. And a lot of folks don't know about that. But the VA has increased the grant amount as of 1 October for severely disabled veterans and service members to adapt their homes. You need to know that the eligible veteran or service members who need to build a ramp, adapt a bathroom, install smart home technology, uh, uh, elevators, all of these things are available under the Special Adaptive Housing Grant, but you need to go on va.gov and take a look at Special Adaptive Housing Grants. And if you meet the criteria, apply for it. Apply for it.
That is true. That's a benefit that we have earned, like uh, modification, walk-in shower, bathroom, stair lifters, and ramps. All of that as we age. No, I no, and I go to my appointments at the VA. Uh, we all in that. There's a lot of us um, veterans in that category, and 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 there's and when you and as you know, there's you have to get on a waiting list, and when you initially apply, it's going to take some time to 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 get you in the system, to get you to get someone to come out to contact you and do the evaluation. So it's very important that, as Anthony mentioned, that you initiate you initiate that process. Uh, if you feel like you qualify, go ahead and start the process.
At one time, and I'm sure the numbers has increased, but fully certified veterans could get up to $108,000 to make modifications to their homes. That's a significant amount of money to go in and revamp your home to your disability. And helpful to you, helpful to your family. I know in my case, with me being visually impaired, my home had to be totally revamped. I was feeling unsafe in my own home. So the VA sent out a counselor to take a look at my home, and she agreed that there were some safety issues that needed to be corrected. And as a result of that, the family shower was changed, steps were added. Uh, I mean, there was so many increased lighting, anything that affected me as a visually impaired, 100% total and permanent unemployable veteran. So Herman and I are telling you real world stuff because we've gone through it. Again, we speak truth into the community. We have helped a lot of folks over our soon to be 11 years online, not only with the B and C, but individuals that uh, had been out of the system for a long time because they felt as though if they were getting compensation and benefits, they would be taking it from someone else, or veterans that were in Vietnam that weren't taking a look at their, not even being involved with the Agent Orange database, which had documented illnesses from that Agent Orange, and they were able to get their compensations and benefits uh, from sexual abuse, uh, all kinds of things that we've helped male and female veterans with. Uh, uh, Suicide prevention. I mean, I enjoy this show, and every time I'm out, I tell other veterans, please tune in and listen to us because we do the research for you and provide you the information and hopefully motivate you enough to jumpstart yourself to go to va.gov. If you can't get someone to help you, to assist you, or even go to the regional office with an appointment and start the process.
And let's talk about the ways you can do it. The first one is, as Anthony just mentioned, online. Uh, va.www.va.gov. That's online. In the form that you fill out is 21-520EZ. That's
Say
online.
that again, Herman.
Uh, it's va.www.va.gov. The claim form that you fill out is 21-526EZ. Option number 2 is by mail, and that address is Department of Veteran Affairs, Claim Intake Center, Post Office Box 4444, Janesville, Janesville, Wisconsin 53547-444. Uh, that's the second option. The third option is your region office, and that's if you so you're in Atlanta, it's the the VA office in Claremont. But whatever state or region you're in is, if you want to file in person, you walk into your regional office and there is someone, they will point you in the direction for someone at the office to assist you in filing a claim.
Now,
My take on that is it's it's not one that I prefer.
yeah,
And, uh,
totally agree. Totally agree. Now, it's not for the faint at heart.
and,
Even
and
though even though the system has improved tremendously, it's still some stop gaps. There's still some time involved with it, et cetera, et cetera. Just to give you an example, uh, what filing my wife and I for the caregivers and the VA, as they always do, you'll get this packet. I don't know if you can see it, but there's a packet saying, and it may be, this one is about 30 pages, and it says, we're working on your claim. And it has papers after papers, forms after forms, et cetera, et cetera. Um, you got to do some work
if you look at the postmark on there, it was postmarked about 2 weeks before you got it.
before you got it. You know what I mean? So it's something that they rubber stamp, they know, and they'll tell you up front, oh, it may take you 120 days. In some cases, 180 days. So it's not for the faint at heart. And they're telling you what you need to do, file your claim and evidence that they need. And then they'll tell you what they need to do. They'll give you all these forms. And I know that it could be depressing, but if you want to get it for yourself and your families, you got to go through this.
And there's a fourth option and a fifth option. The fourth option is to all those forms that Anthony is talking about, is to fax them to a number in Wisconsin. And that number is 844-531-7818. That's
Say it again.
844-531-7818. That's the fax option. In the fifth option is one that I consider one to consider. You can work with a accredited attorney, claim agent, veteran service organization representative to get help filling out the claim for disability compensation. And that is that's saying a lot. Uh, but uh, in my opinion, that's a good route. In the it's it's what we talked about earlier. It's a complicated process of finding a VSO, Veteran Service Organization. Part one, part two is finding a person, a veteran service officer, to work with you. Your your options in dealing with uh, the financial compensation part of it is all that's a big discussion.
Yeah, it's a very big discussion. And again, it's tedious. There'll be highs and lows. But Herman and I can tell you, there is light at the end of the tunnel. You need to be due diligent, persevere, don't give up faith for something that you earn not only for yourself, but for your family. It took me 2 years to go through that process and a number of VA visits, a number of VA visits. And after being prodded and tested and twisted around and stretched, they couldn't do any more. And they realized that my disability was legit. Then we were able to get that. Now, one other thing that is really not spoken about too much. Let's say that you do receive your 100% T&P and you're unemployable. I would tell you to immediately go to the Social Security and apply for disability also. Even if you're not at the what they call eligible age for that particular disability benefit. In my case, I was age 62 when I received my 100% T&P and unemployable. My VSO advised me the following week, go to the Social Security and apply for that. And they're totally separate systems. They do not take the VA rating as gospel. You go through the Social Security testing. And in my case, being visually impaired, my eyes that are really, really, with issues, I met with a Social Security um, um, ophthalmologist who took me through a series of exams. And at age 62 versus waiting at that time, age 66, I was granted my Social Security disability benefit. So I didn't have to wait those 4 years. So what we're telling you is there's an additional step that you can follow through on to get what you've earned again, and that's going to Social Security and applying for the disability compensation under the Social Security Administration.
It's a continued process, as you mentioned earlier. Once you get your 100% total impairment, it's you you just can't say, oh, okay,
I'm done.
uh,
No.
no, I my word for it is claim management. You have to continue to manage the process. Else you else you find your like we talked about earlier. You find that you are getting things taken back from you. So from that point, it's very important. Another another footnote to the what we just went through is if you were just getting started and you just getting in the system, the question is, should I file a submit a form as intent to file? The answer is yes, because
Yes.
to start the clock start ticking, and while you are filling out all those 20 forms that Anthony mentioned, or you getting VSO to help you fill them out, whatever process you go through, the the clock is ticking. So when you do get your rating, whether you get a 100%, 50%, whatever your first rating is, you will get back pay starting when you originally started the process.
Correct. Correct. So again, we speak truth into the community. Again, you're listening to Veterans Today Talk Radio, the WCEG Entertainment Network. Uh, Herman and I are so passionate about what we do because you're talking to two veterans that have gone through it to get to it. Boots on the ground without the fan.
No doubt about it. And while
Boots on
we
the
get
ground
into
without the
that part,
fan. You know what I mean? That kind of thing. So again, we love what we do because we're veterans. We've served. And we just want to share with you. And we just love this platform that we can share information with our listeners worldwide.
and also let me, as the listeners that been on listening to this program aware, is I have a veteran organization that help veterans. I started 15 years ago. My organization is Veteran Helping Veterans, headquartered Atlanta. And the way you can contact me is my email is bvhv3105@gmail.com. Uh, my voice message number is 404-647-2819. 404-647-2819. My website is Veteran Helping Veterans HQATL.org, and we will help you navigate the system.
Right. And as Herman stated, I've been blessed now since 2015 to having another nonprofit called Visually Impaired Veterans of America, with a key focus of raising funds and increasing the awareness of veterans that have various stages of visual impairment. All funding that we receive go to support the Southeast Region Blind Rehabilitation Center at the VA Hospital in Birmingham, Alabama. Uh, but before the end of the spring, we'll be starting a podcast with just really geared strictly to visual impairment issues. I am running into more veterans than ever with various stages of blindness, and that's a life changer. It's a life changer. And believe it or not, individuals in our categories that people see that, yeah, we have on the dark shades and we walk with a cane, but they don't really understand the severity of it because it is a life-changing event. You can't drive anymore. You don't have access to a driver's license. Now you have a personal identification card. And a lot of places we go to, uh, they're not prepared for an individual like ourselves with markings and on steps and railings, and they just don't take it as serious as someone that may have a leg amputated or arm amputated or something like that. And they see you with glasses on, and even though it's not shade type glasses, they don't think that um, you have a disability. And people myself, we run into those, how do I say it, unavoidable scenarios because people don't understand it. So we want to increase that awareness in 2026. And along with Herman, with the Veterans Helping Veterans, visually impaired veterans are going to help those veterans, male and females, that fall into that category.
And and I also want to emphasize is as part of the compensation package for for veterans, and as Anthony know, uh, we everyone, if you're not a veteran, someone in your family is a veteran. So one benefit that's is for widow and spouses, the VIC benefit. That is we uh, I run into quite a few uh, veterans spouses that their husband or their wife has deceased, and they are not in the system to receive a pension because number one, they wasn't aware of it, and number two, it's not something that's on the radar of a lot of veteran service organizations.
Correct. Correct. Uh, we don't know your personal family scenario. We don't ask those kinds of things. But as a veteran, I believe you should be obligated to your family to share as much information as possible. When you were deployed, your spouse or significant other took care of your affairs and your children. They did everything while you were out doing what you needed to do, keeping our borders free and protecting this nation. So it would be really good for you to share that information. Let them know what vital documents are. One, the DD Form 214. Let them know about what the VA will do for you in the event that when you pass. There are a lot of things that you need to share with your family. So when that time comes along, they're prepared. They're prepared because they served along with you. I just didn't serve myself. My wife served. She was on the military installations with me. And when I was deployed for down there a year, going different places everywhere, she was back there doing what I would be doing. She took on my role in addition to her role. So again, we don't know your personal family scenario, whatever that is, but we're just saying to you, as a veteran, consider sharing information with your family members to ensure that they know what to do when that time comes. And they need to have documents, they need to have information, they need to know what to do and where to go.
And uh, going back to another item that we talked about earlier is uh, is the the fee situation for claim services for whether uh, getting a VSO from uh, one of one of the organizations. Uh, I mean, the major ones are DAV, the American Legion, VFW, Vietnam Veterans of America, Disabled Veterans, and that's six of them. There's one more. I mean, those are the major uh, uh, organizations that provide the VSOs where uh, your probability of getting services and not being charged a fee is good. The second option are are your state uh, organization in Georgia, the Georgia Department of Veteran Services does a great job. And along with that, there's actually uh, a bill at the legislature this session dealing with agents and attorneys charging veteran fees and veterans not being aware of it until till after the fact. Uh, because in the document that just came out yesterday that I sent Anthony a copy of, there's the VA actually states that a certain if the agent is or attorney is certified, uh, they can actually and you sign. Uh, it doesn't use this is the exact word, but if you sign the power of attorney, let them represent you. The VA will actually pay them 20% with once you, and if you file a form to uh, start the clock ticking. So some of these guys, some of these people are getting paid, and the veteran not even aware of of it because of this. Uh, the system didn't put it out there.
Right.
So,
The system didn't put it out there. So again, that goes back to doing your due diligence, making sure that you do the right things and at the right time. Um, because tomorrow's not promised. Tomorrow's not promised. And if we don't take initiative to follow through, and when that time does come and then it's chaos, it's because we just didn't slow down long enough, put things together, and go through what you need to do. Um, you know, another thing that is really, really important right now, Herman, um, is the housing. I got to reemphasize that. I'm getting calls all the time from veterans about getting a home. Well, there is a VA benefit for you in getting a home. VA loans, VA approved loans. So again, go on va.gov, follow the steps, and it's all based on your particular part of the country, your county, and certain amount of money is allocated towards that. If you have a certain credit score, and I think at one time it was like 620 or 640, I can't remember if that number is increased, and then a certificate of eligibility. If you have those two documents in place, then you can go out and find you a home and work with a broker or a realtor to find you a home to go through the process and get approved. I know I did. And that was way back in 2000. No, the first time I did it was 1975 when I was a young captain at Fort Benning, Georgia. And I've utilized it all the time. My current home that I purchased in 2009, same thing. You're eligible, get that certificate of eligibility, have the required credit score, and work with a broker to get the home that you need for your family.
and speaking of housing, Anthony, uh, there are two other elements of housing is uh, is people that are and the VA has some benefits available. Now, people that are out of work are people that are temporary. Uh, you out of work or you have a health issue that's have you unemployed for 3 months, 6 months. You get behind in your rent, and you need rental assistance, housing assistance. There's because I get those calls almost weekly, where people are in situations where it's because of change in lifestyle or because of other issues is uh, veterans need rental assistance, and so there's uh, there's a VA program that deal with that. It's actually part of the VA homeless program. I wasn't aware of that this week till another a VSO called me uh, because the the VA homeless program was calling the Veteran Service Organization asking them for help. Uh, it's so there are I'm putting this out there because there are missing points in the system that are not covered, and things sometimes and people lives of are getting affected uh, because things fall through the crack.
Yeah, it fall through the crack. And again, it's going to take due diligence on your part. And I got to reemphasize, if you're unable to get online to do these things, ask for help. Ask a niece, a nephew, or cousin, or a spouse, or go to the library and have someone help you get online to get things done. It's you earned it. You earned it. I mean, I remember meeting a veteran who was a Korean War veteran in a wheelchair, close to 90 years old, never went into the system to get compensation. Never did. But through encouragement and talking to his daughter and niece, he was able to get into the system and got the help he needed. He had been going to the VA, but he never filed. No one told him to file. They just saw Soldier X in a wheelchair, X illnesses, and it was like a laundry list of things that he could have been receiving millions of dollars for, not thousands. We're talking Korean War now.
Yeah.
We're talking Korean War. Millions of dollars that is just gone. Another story of a veteran from the Vietnam era, same situation. Got disgruntled. VSO died. He quit. His wife contacted me. We got his Social Security number, got his DD Form 214, and got him into the system. He was receiving compensations, and within a year, he died. Just think all the money he lost.
I had
All
a
that.
conversation this week with the VSO, and he had just helped a veteran that's 102 years old, and he met that veteran when that veteran was 101 years old, and that veteran, uh, World War II veteran, uh, so he didn't even he once he applied, everything went through. But this veteran was 101 years old before he even applied and got his benefit.
Again, the VA is not going to tell you jack. Okay? They're not your buddy. It's a monster. It's a huge, huge organization. It is the largest healthcare system in these United States that serve 1% of the population. Most folks don't realize that the armed services is only 1% of the total number of residents in the United States that protect the borders. So don't tell me, oh, I might be taking somebody else's benefits. Are you crazy? You served with dignity and honor, keeping our borders free, sacrifice. Please, please follow through. We can't implore you enough to follow through. Please do it.
Uh, and we have earned it for our family. We have earned it for the community because we help our families, we help the communities, and a, a thing that ever since me and you started this program is that I still encourage people to do is start veteran ministries. Uh, that's that's one way to provide more outreach and more information to veteran family and the community.
Yep, 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 yep. I was just thinking, a few minutes ago about our information flow, our information flow to our veterans. It is so, so important that we continue on a to bi-weekly basis to provide that information to our veterans and implore them to do what they need to do. Because we've been through it. Again, we were boots on the ground without the fan. And we just want to let them know that they can come and listen to us every 2 weeks. Veterans Today Talk Radio, WCEG Talk entertainment group.
We do have homework, and the information that we provided today is, I was sitting at my computer going through my email yesterday, and the email showed up at 2 o'clock. So it's current. It's dated February 5th, 2026. So the information we are providing today is update, it's current, and it's from provided by the VA.
Yep. So, we always do this, Herman. I know we got less than 5 minutes now on the show, but again, my brother, my friend, my frat brother, everything. We've been doing this now going on 11 years, and it's been a joy. But it all started with Penny Rogers and her vision and mustard seed. And we always have to give her kudos. And to Miss Vivian Greer, our production manager, our keep us together with these two ladies. They just help us tremendously. And we want to show our appreciation to them because our success starts with the both of them. And I'm sure you agree with that.
I agree with that 100%. And we also a member of WCEG Enterprises. The entire organization is growing. We want to make our listeners aware there are quite a few options that covers topics that empower the community. We encourage them to tune in to all, make a selection, time permit, tune into whatever programs that you can. Uh, we thank everybody, and it's been a great day.
A great day, Herman. And I know we won't be on for another 2 weeks, but again, as we started to show off, this is the tax season. Please get your affairs in order to file. Herman gave you some great information about benefits and compensations. We talked about the importance of the DD Form 214. We talked about the special adaptive housing and how you can get funding for that. Well, we just talked about a lot of things that could help you and move forward to your family. So again, Herman, my brother, it is always a joy to be on the air with you and to share truth to the community for our listeners worldwide.
It's been a great joy, and I want to emphasize one of the programs that I think we the caregiver program is we it's my goal to highlight that more this year also.
Excellent. Absolutely. And hopefully I'll be successful as you, Herman.
Sounds great.
Take care, my friend. See you in a couple of weeks.